All right. So the first one is before treatment, one word you associated with osteoporosis medications.
The one word was risk.
One thing you would share with postmenopausal women now after completing osteoporosis treatment.
Do it.
Do it.
That's
Can
it.
you share that again?
Do it.
Thank you. One word to describe how your body and health feel today compared to 5 years ago post osteoporosis treatment.
One word. Confident.
Hello and welcome to another episode on Hormones and Hope. This is your host, Dr. Makhija, and today is another special episode. But I'll put this in quotations. This is a very special episode. Since I usually will have guests who are physicians, or you've heard our solo podcast. But today I have a amazing professional. She's a retired dentist and also a patient. And she's been with Unified Endocrine Diabetes Care for almost 3.5, 4 years, which is in California. That's our practice. And to my delight, she's been amazing with her health. And today she's going to share about osteoporosis journey. Now, the reason I'm calling this as special, my friends, is because her profession, which is relevant to our oral health, oral hygiene, and dentition, and osteoporosis medications, which have this rare side effect, which we'll get into the details. But as a patient and as a physician, how a human being can actually make the right decision for their health and still be successful in their health journey is what we're going to learn from our guest today, which is Dr. Cynthia. It's my honor and privilege for you to be on our podcast and share the journey. And I feel by the end of the episode, you're just going to empower so many women out there that there will be showers of gratitude for you. So thank you, Dr. Cynthia.
Well, thank you for having me.
Yes, yeah. Before we dive into our usual rapid fire and deep dive questions, can you tell us something about yourself? Where you live or how many years you've practiced and anything special with your enjoyment in the dental world? Anything fun about you?
Well, I practiced dentistry for about 40 years. And in my early career, prior to going into private practice, I actually did a deeper dive into medicine. So I worked in hospital settings. I did residency that allowed me to really expand upon medical parts of dentistry instead of just going in there and drilling and filling. So that was kind of early history stuff. Other than that, I enjoyed a very long and happy career.
Not retired. So I love that long and happy career. Thank you. So we have our rapid fire questions for you. These are, again, one-liners, or if you think you have a one-word answer. And then we deep dive. Deep dive is just about the bone health, osteoporosis, and some fun stuff that we learn from you.
Okay, cool.
All right. So the first one is before treatment, one word you associated with osteoporosis medications.
The one word was risk.
All right. Risk of osteoporosis medication. Sweet. Number 2. One concern you had that was stopping you from starting osteoporosis medications.
Again, it was the risk, and the risk was associated with what I knew academically about what osteoporosis medications do to you, as well as what I saw in my practice. So I saw enough cases of the side effect that I thought, not going to do it.
Thank you. Number 3, as a dentist, what made the decision to consider osteoporosis treatment harder for you? The same?
Yes, it rolls back into question number 2.
Can you tell us those 2 risks or one risk?
Well, the one risk that we see is in dentistry is called osteonecrosis of the jaw, or ONJ.
Number 4, one thing you would share with postmenopausal women now after completing osteoporosis treatment.
Do it.
Do it.
That's
Can
it.
you share that again?
Do it.
Thank you. And number 5, one word to describe how your body and health feel today compared to 5 years ago post osteoporosis treatment.
One word. Confident.
I love that. Thank you so much. So now we get into the deep dive.
Okay.
And, Dr. Cynthia, like I said, we've been together as patient physician, but also you've been a great supporter and, and friend for us at Unified Endocrine. When did you learn about the diagnosis of severe osteoporosis? And how long did it take for you to get convinced? So, can you just walk us through that period before we met?
Well, I have a history of my family history is of osteoporosis because I'm lactose intolerant. So I never drank milk as a kid, and my eating habits were poor at best. So I knew, and my grandmother, she actually had fractures because she was osteoporotic. She had fractures just by reaching into the cabinet to get some spices. She fractured her vertebrae just by doing that. She wasn't doing anything. She didn't fall down, nothing.
Wow, that's severe.
Severe. It's, and she fell and broke her clavicle. And yeah, so that's my background history. Now, my mother, on the hand, she wasn't lactose intolerant. And so she drank a lot of milk. She ate probably better than I did. And her bones were very, very healthy. So I knew in my 40s that I was already osteopenic. I already knew.
Okay, so you already had the awareness, the screening test, and you were well informed about the diagnosis. So from around mid-40s that you were more perimenopausal to almost what, 62 or so, 63, that you decided to start treatment. So what was that? Why the duration? Why did it take so long? And what was done during that time in terms of prevention or lifestyle measures?
Right. Prevention, I exercise a lot. I try and do weight-bearing exercises. I would be very, very body at best, taking calcium supplements. I tried to eat like calcium-rich foods that weren't dairy-based, but you have to eat a whole lot of spinach to get the kind of calcium you need to get it from other sources. So, and I just thought that I would be like my grandmother. There were no osteoporosis medicines when she was alive. So she broke bones, she healed from them, and she lived to be 5 days short of 100. So I thought, okay, that's going to be my journey. And then my cousin, his mother, is a pharmacist. She's now in her late 80s. But her pharmacy story is that she wouldn't take it either as an osteoporotic gal. And so when she didn't take it, she actually fell and horribly fractured her vertebrae so that she had to have surgery to stabilize.
Yeah.
So when they went in to do that, what happened is they had to put a rod in her spine, and they were drilling into cottage cheese.
Yeah.
Literally.
Exactly.
It was mushy.
Yeah.
And so it was failure. They could not stabilize her. And so now even till today, she's bedridden. She can't get out of bed, and she is in horrible pain all the time.
Yeah.
I go, I don't want that either.
Yeah.
So that's actually what it was, fear and a sense that maybe that's going to happen to me, that I said, okay, I have to do something about it now.
Yeah. You bring up very good points. One was, the awareness, and you were already thinking about prevention by getting the screening and knowing that what's happening and what could I possibly do. But then I have this either fear or anxiety of being on medications versus my risk of not treating it. I just wanted to point this out because I usually will add this in my first discussion when individuals are coming for the consultation, that which I really want you to elaborate on would be the risk from your specialty. But in United States of America, 2 million adults experience osteoporotic fracture annually, and most of them are hip and spine. So what you were mentioning about your pharmacist friend. And within 1 year, the risk of mortality is 1 in 3 for men, which is insane, and 21 to 30% in women, so 1 in 20. So for men, it's actually higher as compared to women in terms of the mortality after 1 year of hip fracture. That's insane.
That's crazy.
And the dependability, being in institutions, rehabs, hospitalizations, again, which you were talking about, your friend's mother's surgery. And what's sad is that the risk that you are again going to elaborate, the ONJ and the osteonecrosis of jaw and the atypical femoral fractures, the incidence is lower. But before we go into that, can you just shine more light based on your expertise in the dental world that what you've encountered with osteoporosis medications and ONJ and what built that concern over time?
Right. Well, the academics are, you see the red box label, warning, warning, this can happen to you. And then, of course, in all of my studies, and I don't think it was during dental school because that was too long ago, but it was after dental school and all my other continuing ed classes. When you see cases of osteonecrosis of the jaw, the scary thing is that if you have any kind of dental infection, like, you need a root canal or you have gum disease, or in one case, one of my friends told me his patient, all she did was she ate something hard and it poked at her gums, at her gingiva. So all it took was that, and it started to affect the bone, start to kill the bone.
Yeah, and this is all in patients on osteoporosis medication.
Yeah.
Like the bisphosphonate.
Yes, bisphosphonate especially.
Like the Fosamax, Actonel.
Exactly.
Okay.
And the scariest thing is that there's nothing that we can treat it with. You can't give it antibiotics. There's no medication to stop this bone destruction. The only thing so we see it, you go, oh yeah, you have your bones dying. And all we could do, literally, and it's just a horrible visual, is scrape it out, scrape out the dead bone and hope that your body will fix it. And then they come back. Now there's more that's dead bone. You scrape out more. And eventually you either lose all your big portions of your jaw and your teeth, or your body eventually kind of says, okay, let's try and fix it.
Yeah. Clinically, did you see that there were like predisposing factors
Yes.
based on their oral hygiene, or say some patients have, poorly controlled diabetes and they already have poor gingival health? Any predisposing factors?
Actually, the studies that I saw were long term bisphos use and people who were had chemo. So cancer patients who are already at risk for a whole bunch of other things.
Yes.
So if you had chemo any time in your history, you are way more predisposed to getting ONJ.
Yes.
So that's
So what you were witnessing clinically is also, seen in our literature and studies and clinical trials. So that's again a very valid point, and I love the fact that your last rapid fire was the confidence.
Yes.
That you've come up with, and the confidence also to share this with especially my women patients and whoever would be the audience, or if your spouses and your wives are, dealing with this confusion, should I consider osteoporosis therapy or not, is I would love for you to repeat, but ONJ, the incidence that I have is, 1 in 10,000 to 1 in 100,000. And of course, it's higher if patients have had cancer, chemotherapy, or bone metastases.
Right.
Because just for the audience's awareness that medications like bisphosphonate, Fosamax, Actonel, or even Prolia, that's the 6-monthly injection, they can also be used for treatment of osteoporosis or prevention of fractures in patients with cancers.
Yes.
Different types of cancers. So I really love that you're overlapping the clinical medicine with what we have in clinical trials. So again, lots of empowerment.
I have a personal friend who he has prostate cancer, like aggressive. And how he even found it, because he didn't like going to the doctor, is that he actually had bone pain. Okay, it had already metastasized to his bones. And his bone was cottage cheese as well. He's really short now.
Yeah.
And I knew him as a 20-year-old. He was tall, and now he's as short as I am.
Yeah.
So he was shrinking and stuff. Well, they ended up giving him bisphosphonate just because they didn't want him to fall down and hurt himself. And guess what? He's been on chemo, he's done this and this, and he hasn't had an ONJ.
Yeah.
And he's had dental infections and he hasn't had ONJ. So here's that.
Exactly.
You never know if that's you or not. I can catastrophize and say, everybody who's on chemo is going to get it. No, that's not true.
Yeah. So yeah, you're so right. That brings me about to a personal share, which I wasn't planning to share, but, because you're talking about your friend's story, is my father, he had multiple myeloma. And for almost, 15 years that he was with it and fought with it. And the main thing that it affected was also the bones. So it's basically osteoporosis. And he was given, so because it's a blood cancer, reclassed also, zoledronic acid, but it was timed based on kidney functions or renal functions, but also to see what's the mobility, what's the functional health. And there were 2 times that he had a fall just because he was riding a scooter. He was very physically active throughout, and he did not have a fracture, which I would
Good.
think that, oh my gosh, with severe osteoporosis, yes, you're on a reclass and you fall on your hips, like on your butts or buttocks, and you did not have a hip fracture. I started truly appreciating osteoporosis medications at that time. Now, this is almost 10 years ago. But you bring about the right, again, that knowledge that every person with malignancy using osteoporosis medications does not necessarily go
Right.
through ONJ.
Well, and there's a whole balance of
There's a
quality
balance.
of life.
Yes.
So,
Yes, absolutely. So, with that, I would love to also learn more about when you say the balance, the quality of life, right? The the patient physician shared decision making. Now, yes, you're a physician, you're very well read and very well researched too in terms of, the preventive measures as well as the treatment measures or pharmacological. When we met, you'd already read a lot of studies. What I remember, this was 3.5, 4 years, and saying, oh, but this happens, and so on. Yes, you said that the fear convinced you that you should start the medications. But can you walk us through that journey, like helping someone else simplify decision making? Yes, the articles, but everyone is not well read like you. But what was a discussion? What was the state of mind for you to say, let's do it? I've read enough, I've known enough. I think this is the right, or I believe now this is the right step.
well, I can tell you right off the bat that from the time that I was osteopenic so early,
Yeah.
every every physician said you need to be on bisphosphonate, and I would say no, and they'd say you need to be. Are you refusing treatment? I'm going. Well, guess what? And I'd look him right in the eye. I said, can you guarantee that I will not get ONJ? Because I can't even guarantee as a dentist that I won't get a dental infection. Dental infections happen, you don't know when it's going to happen. Saturday night and at midnight, go, oh my gosh. So they would say, no. I said, then stop talking to me about this. And they would stop because they knew that I knew that risk because I saw the risks on not a daily basis, but enough where it says, no, note to self, I'm not going to be on this medication. One of my dental school mates, who she's another female dentist, her physician convinced her, look, just take it premenopausal, just for a year, and that's going to cover you. And in retrospect, I should have listened to that kind of advice, but I just was too stubborn. So stubbornness is not a good quality, I guess. So, but it was I am probably more active than my grandmother was. And so I knew that my risks for having an active life was going to be affected by the fact that, hey, if I fall down, but as just a side note, I have worked forever on balance. So all of us need to work on balance because it's not even about the hip fracture or it's about just don't fall down.
Yeah.
So,
Yeah.
so
Right. So once this was what, again, 4 years ago, once you're seeing the repeated scans done, and there is this decline,
yes.
leading us to from osteopenia to severe osteoporosis, which is based on T scores. You did not have any fracture.
No, I did not.
How did you decide now? So now you need more powerful medications,
Yeah.
right? So what convinced you?
Part of it was doing a little deep dive into, okay, I don't want to just spare my bone. I need to build bone. And too late, Kate. I just didn't do the right things for whatever reason that I just couldn't build bone. So I thought, well, okay, this is it. And this is it's also involves risk. taking,
The
Timlos,
daily
the
injections.
daily injections is a risk as well. And then again, there's a friend of mine she's Asian. She's even thinner bone than I am. And she actually had been on Timlos for even longer than the recommended. And she didn't get osteosarcoma. She's
Yeah.
perfectly fine.
Yeah.
So I thought, well, I'm going to follow that rather than my own fears.
Yeah.
That's what it is.
Yeah.
So,
Yeah. I just wanted to add this that osteosarcoma is only seen in rats or
yes,
animals.
exactly.
We don't have it.
Exactly. Yes, exactly.
Yes. Good.
See, I'm a catastrophist.
No, I'm glad you're sharing that because, every person out there has this concern that if
Yes.
there's a black box warning,
Yes.
that it might happen to me, even though it says it's going to happen in animals.
Right. And I read that. I saw that.
Yeah. So when we met, the Timlos was started because I agree that when we're in severe osteoporosis and we don't have any contraindications,
Yes.
use the bone forming medications rather than relying on these anti.
It's expensive too. And again, so I've already
Yeah.
kind of come on to that whole thing. Shoot, I could have saved myself a whole lot of time
Yeah.
and money.
Thank you. That's a great point that
I
you're
could
putting
have.
about.
And I just didn't do it.
Yes. Yeah. Yeah. And I wish that they're more, because we're trying to prevent something with good medication. So hear out if any of the, large institutions are watching this. As we talk about prevention, we know the stats of fractures. Please make these medications more affordable.
Yeah.
Your decision was different than other patients, but that I call that as personalized, and that is also a great informed shared decision making, where you used the anabolic therapy or the bone forming medication, which is a daily injection, for almost a year. We have the FDA approval for 18 to 24 months. You probably had more than
I was
12
more like
months,
close to 8
right?
months.
How did you feel while you were on the medications? Were you able to still continue living your life, travel, anything that you would like to share in terms of your personal experience?
Yes. Well, it would, and I'll be really honest, it would make me a little nauseous for about 20 minutes after the injection every night. So I did it at nighttime so that I could just lay down and not just go to sleep and not feel nauseous or nauseated. Um, it put a little crimp in because you have to keep this stuff refrigerated. It put a little crimp in my traveling, but you just have to make sure you have a ice chest or that kind of thing around. Other than that, it was really not that big of a deal at all.
Yeah, yeah.
It doesn't hurt either. It doesn't hurt. You don't even feel the needle is so thin.
Yeah.
You don't feel it. So
Yeah.
that part, if anybody's afraid of that.
Yes. Thank you. So, but otherwise, the entire course was pretty much uneventful for you.
Yes.
Right. And then, these medications are followed by something called as anti-resorptive. So you went through that also. And now it's almost, 2 years since the last part of the treatments. During treatment versus now 2 years, right? You've had more bone density scans to see the results. So can you share that in your own words?
Yes, it's pretty amazing. I am building more bone even though I am not on any medication. And here's a Medicare, anybody out there who has to do that thing.
Yes.
I wanted to change plans. And I wanted to go with a plan that it wasn't age related.
Yeah.
Because, you go on it, you go, okay, every year, just because you're getting older, your premiums go up.
So my friends, this is health insurance plans that you're talking about. Okay.
So when I was changing plans, okay, this is totally cool to me. When I was changing plans in November, they were grilling me as if they wanted to know my predisposing factors, risk factors. So I had put in online like a screening thing. Do you have osteoporosis? And I put yes. Guess what? It says you're not qualified for this plan because they want the healthiest of healthy for the plan. And so I backspace, delete, and I said, well, guess what? I am not osteoporotic anymore. So I put no. And then they called me to get more information.
Uh-huh.
And they go, oh, so are you on osteoporotic medicine? I go, nope. If I had said yes, because
Yeah.
then I would have, again, not qualified for this for the plan that I
For the
chose.
right health.
Yes, and they accepted me. In the end, they accepted me.
Yeah.
Because they said, when's the last time you took osteoporotic bone medicine? I said,
Yeah.
2 years ago. And I was totally was not fudging at all. Just wasn't. And that is just an aside.
Yes.
I would not have expected that. And so it's all good.
Yeah, it's all good. Yes. And the goodness is also, when we speak like in terms of data versus translating that into for the patient's language, that, you had severe osteoporosis where the risk of fracturing is very high. And within 3 years of treatment, you've had 2 bone densities, which still shows that the bone is, building bone.
Yes.
And now it's from severe osteoporosis to osteopenia, low bone density, which is massive reduction in the risk for fractures. And this is beautiful because in the United States, we have to enroll in health insurance plans that automatically reduces your risk, makes you healthier, and you get to opt a plan which is favorable for you rather than paying extra amounts. Thank you. These are all learning lessons for what you're sharing. For what you're sharing in terms of, healthcare cost, your health, your independence. How do you make that shared decision making? How do you, make sure that you simplify the research and the data and don't wait too long to make that decision? Can you also add what you've done? When you said you're very physically active and exercising, right? What are your few important necessary steps in your daily routine most of the days that's helping?
I'm going to step back.
Yeah.
Like maybe 15, 20 years ago. When I was in practice, I played this game when I started feeling like, gee, I'm getting old. But I wasn't old yet because I'm old now. And I would play this game when patients would come in who I knew they were retired, just because, I know. I'd say, because I always just look at their chart. I know what the birthday is, right? I go, how does this person act, look, interact with me? And then I'll look to see how old they are, go, oof. And then I'll ask. And one gentleman, 2 people in particular, one gentleman, I said, I know he's retired. He tells me all the stuff he does. But he acts, looks, and thinks like he's about 55. He plays tennis like every other day, all this stuff. We talk politics, we talk sociology. He's really bright, really sharp guy. So I look at his chart and he's like almost 80. I go, so I asked him, how did you do that? Because I want to be like you. Because I'm totally honest at this point. And he goes, doctor, it's called just keep moving. He says, going to the gym, playing tennis, they're all necessary. Putting on my socks is optional, literally. The minute I get out of bed, I know I have to move. I thought, okay, so I've really taken that in as put that as a thread in my daily consciousness of, okay, you got to keep moving. So when you don't move, that's when you don't move. That's it. So is that answering your question? Because I'm not
That's like
sure.
purely words of wisdom.
Yeah.
Movement, and we may think that, oh, you have to do this. There's some magic mantra or magic pill that needs to be done, but it's as simple as keep moving.
Yeah.
Yeah.
I'm happy to say that, my granddaughter who's 16,
Yeah.
she now motivates me. Papa, I want to go to the gym
Uh-huh.
because she wants to go to the gym and she knows I'll take her. So that's my motivation to get moving, because if she's going, then I'm hanging out with her, I'm spending time with her, and I'm accomplishing my needs of moving.
Yeah. So you're trying to fit that in your, in your daily routine rather than making it separate. That's beautiful. Last words of wisdom. And this is especially because we spoke, a month ago. And after looking at your bone density, I was like, Dr. Cynthia, can you come on our podcast and just share some words of wisdom for so many of my patients who are still hesitant, despite having, I would say, 10, 15 conversations? Any words of wisdom that you would want to pass along to our community, to the women out there dealing with osteoporosis, still in that confused state of, should I do it? Should I not do it? What else can you provide them with today?
I would say set aside your fear. And if it's not fear, it's doubt. Okay. Set aside those doubts because you're going to always hear something on the dark side of any treatment, and just do it. I didn't think that I would be as delighted with my results as I'm really surprised. I thought, well, I can at least hold my own, just stave off things. But no, I feel definitely better. I have less fear, literally, of falling, and still work on your balance. I'm still working on my balance, but if I fell now, I know that I go, oh no, 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 no. So yeah, sit down fear and doubt. Just do it.
Yeah, just do it. Just like
do it.
Nike says.
I know, it's true. It's really true. It's true.
Well, I appreciate this. Thank you.
Well,
This
thank
was
you for having me.
simple and powerful. So, yeah, no more words for us.
All right.
Thank
You're
you.
welcome. Thank you. Thank you.